Hello, everyone. Welcome back to Fertility Village Live. I'm Marissa.
And I'm Joy. We're so excited to dive into a topic that affects so many in the fertility world, but is often oversimplified or misunderstood: weight, BMI, and the fertility journey.
Joining us tonight is the amazing Dr. Sarah Zadek, a naturopathic doctor with over 14 years of experience in pharmacy, clinical care, and reproductive health. She currently practices at Conceive Health and is so deeply passionate about supporting patients in all bodies.
Yeah. We're going to be unpacking the complex relationship between body weight, hormones, and fertility. Whether you're navigating fertility now or planning for the future, you'll leave tonight feeling informed, empowered, and supported.
Dr. Zadek, thank you for being here. Before we get into all the jazz, can you please just tell us a little bit about yourself, give us a little bit of an intro, and then if you can, share what inspired you to focus your work on fertility and hormonal health?
Absolutely. First of all, thank you so much for inviting me here tonight. I'm really excited about this topic. It's something that, with my background, I think multiple things have intersected in my life to kind of bring me to this point with fertility healthcare, but specifically with weight management, BMI that we're going to talk about today, and reproductive healthcare. I've always been passionate about biology, health, women's health in particular. And I think that historically, this is an area that's been pretty overlooked, right? And I think that education is one of our greatest tools. So it's really my joy in life to learn as much as I can and pass on that knowledge and teach and share as much as I possibly can. I've also been through the system as well. I have endometriosis. So going through that in my 20s and 30s. I've seen doctors and reproductive clinicians, and I've, been given the options and have gone through this. So it was also a personal journey as far as like doing research on what do we know and how can we, improve both quality of life but also fertility. And that's what brought me to writing the book that I wrote a couple of years ago called "It Takes Two in a Uterus," which is a fertility guide, but it's also just a guide on healthy aging. And a big chunk of this is, what we're going to talk about today, the connection between our genetics, our lifestyle, our diet, all of these factors that affect our metabolism and our chronic health outcomes, but especially also fertility.
Let's start with some science. You've written that BMI is not the be all and end all. Why is it still so widely used in fertility clinics?
Yeah, so BMI is a calculation that really just compares your height and your weight. And it gives us an idea of, the status of overweight or underweight as a flag. It's used so frequently just because it's so cheap to use and it's really easy for clinicians to use. So looking at trying to keeping things consistent from clinic to clinic or even like state or province to one another, it's really easy to gather a lot of data and do research when we have a very cheap way of measuring something. So keeping in mind, like this is a screening tool. It's not meant to say that, if you have a high BMI, you're definitely overweight or obese and you definitely like can't get pregnant. It doesn't tell us anything about your metabolic health. It's really just a way of doctors to flag you being like, "Hey, is something a little bit unexpected? Like for your height, is your weight maybe a little bit lower or higher than we would expect for someone as tall as you are?" And because humans are not all made the same, and we also can't get a look of body composition just from BMI alone, right? So body composition machines, if we actually want to look a little bit deeper and actually get more information on body fat percentage or lean muscle tissue percentage, body composition machines aren't really all the same. And so some have different accuracies, some are more expensive than others. And for patients and for clinicians, it's really hard to keep this consistent. So, because of the difficulties in that, BMI is an easy to go to tool that a lot of clinicians will use first, but we will get way more information on metabolic health if we can actually do a body composition measurement. Yeah, and that's something that we try to do in our clinic. It's not available obviously for all patients. I do see a lot of patients who are, not in the GTA or the Toronto area. And so we see people who, don't have access to these machines. So that's where I mean, BMI is often used as the first flag, and then we kind of take it, from that point.
Well, thank you so much for explaining it. I don't think I've ever heard such a thorough explanation of what BMI is and how it's used. Usually you just go in and they're like, okay, your BMI is this. And you're like, okay, but how does that relate? But it's not the main topic, it's everything else that comes after that. So thank you for explaining. Very, very good piece of education. Okay, so a question related to that: can someone be classified as overweight or obese and still be metabolically healthy?
Yeah, absolutely. So again, keeping in mind that BMI is not telling us about your metabolism, right? It's just the flag. So we also have to keep in mind what different tissues weigh in our body. So muscle is going to weigh more than fat. And if you're building a lot of muscle and you're kind of bulking up more than the average person, like your body weight's going to weigh more than if that tissue is on fat. So
Makes
sometimes
sense.
even when patients are going through weight loss, they'll come to me and say the number on the scale hasn't changed, but I know that like I've been working really hard and like there has to be some changes. And I'll
Mhm.
stop them and I'll say like, how are your clothes fitting? Right? So we have to
Yeah.
remember that the number on the scale doesn't tell us anything. And you might weigh the same amount, but maybe you've dropped that adipose, that fat tissue, and you've gained more muscle. So that's also why, I mean, BMI can't give us that information, right? So in these cases, measuring body fat percentage is much more accurate of metabolic health as well as inflammation as well. So ideally, again, there's ideal ranges here, and then there's the like, okay, well, when do we actually really need to take this more seriously? So
Mhm.
for fertility, we're aiming for about 18 to 25% body fat.
Okay.
Again, everyone comes in different shapes and sizes,
Mhm.
and that's something we have to keep in mind, right? So I wouldn't tell somebody to super stress out if they have 26 or 27% body fat if we also have really good health habits lined up. A BMI, or sorry, a body fat percentage of 40, would be more concerning because now we're dealing with excess adipose tissue that has other effects in the body. And then lastly, I want to, also bring up like distribution of weight is also a big factor here too. So we do have evidence that, waist circumference and hip circumference are actually better predictors for things like visceral fat accumulation and metabolic disease. So we can use like waist and hip ratio measurements as well as body fat percentage to kind of give us a better idea of like what's happening in and around the body. And we know that, I mean, BMI, we tend to say, when someone's obese, they have, more inflammation in the body, but it's actually the body fat percentage that has the stronger correlation with inflammation. So this is why it's more about the amount of excess adipose tissue or fat tissue that we have on our bodies, not necessarily BMI as a standalone number that we're worried about.
Wow.
So you've
Okay.
mentioned adipose tissue a few times.
Mhm.
What are some of the hormonal and immune impacts of excess adipose tissue that can influence fertility?
Yeah, and I find this really interesting too because we don't often think about fat tissue, being active, but it's actually a hormonally active tissue. So I'll kind of break it down. We'll start with maybe like the hormonal side, and then I'll go into inflammation. So we have to remember that fat tissue is a storage tissue, right? So it's going to store enzymes, it's going to store hormones, it can store these inflammatory cytokines. On the hormonal side of things, adipose tissue has an enzyme called aromatase. Some of you might have heard of this because we use sometimes medications in fertility that affect aromatase. So aromatase in fat tissues converts testosterone into estrogen. If you have more of this enzyme, more adipose tissue, then you might be converting more testosterone into estrogen. So this is where sometimes you can get these like what you might have heard as like hyperestrogenism, disorders, right? But it also creates an imbalance because we want to have testosterone and estrogen regulated properly for fertility. But this is one of those things that kind of tilts the scales a little bit heavier on the estrogen button. Okay, the second area is the metabolic side. So, fat tissue is our emergency energy reserves, right? It's there because if we need to be able to expend energy, if we're going through these long bouts of stress or training or whatever it is that we're going to need energy for, the body's ready to like release this and break it up if we need to dip into those reserves. So, one thing that adipose contains is leptin. So leptin is more related to appetite control as well. It feeds off of and it takes in the signals from body fat percentage, but also insulin. Funny enough, so we think of leptin as being this like metabolic regulator for appetite, but it also tells the pituitary gland to release certain hormones that affect fertility. So luteinizing hormone, LH, and follicle stimulating hormone, FSH. And this is also what regulates follicle and egg growth and development, and luteinizing hormone being our trigger hormone for releasing the egg for ovulation. Well, we have leptin receptors and insulin receptors in our ovaries and the uterus. Men have it in testes, right? So these are not just about appetite, but these are receptors for hormones that are, in the ovaries themselves and can affect egg development and ovulation. Leptin's a really interesting one because it also ties into the obesity kind of feedback loop. So when we have too much leptin, so too much body fat, too much leptin, what this does is it can decrease progesterone and estrogen, and you can also get leptin resistance. So if you're constantly having really, really high leptin, all of a sudden your body doesn't really want to listen to the signal anymore, and it can actually lead to poor appetite regulation. It's why it makes it harder for some people to lose weight because they still feel hungry after a meal. Like you can finish a meal and maybe still feel hungry. That's
Mhm.
that leptin telling you, like, hey, we still have a big appetite, but it's the leptin resistance that's interfering, with that signaling. And then the other one that I mentioned was insulin, right? So this is a really big one. We hear about this a lot with like PCOS patients, right? That insulin resistance. So insulin regulation also, so insulin receptors also in the ovaries. They also affect the hormone production in the ovaries that affects follicle development and ovulation as well, right? So hence why when we have insulin when we have poor insulin sensitivity or we have excess hyperinsulin, states, we can actually impede follicle development. It actually, can kind of brings the follicles up to a certain level in development and then kind of halts it and kind of stalls them out a little bit. So
Mm.
hence why in PCOS we often see delayed ovulation or really long cycles because you're getting this interference from these hormones that will impede that development, and that'll affect the timing of ovulation as well. Yeah. And then, so the immune side of things, we do know that, I mean, it's been very well researched that obesity is associated with this chronic low grade kind of inflammatory state, right? We tend to see really higher levels of what we
Mhm.
call reactive oxygen species. So like oxidative stress, oxidative damage. These are like little micro damages that can happen to our proteins and our DNA and our cells and our tissues, right? So a little bit's probably not going to do too much harm. We actually need some of these signals for proper, cellular functioning. But it's the going over and above when there's too much, when the body can't control it. That's when we're going to start to see damage, right? That plus inflammatory cytokines. We see this shift in our immune cells from a more anti-inflammatory state to more pro-inflammatory, right? So we've got oxidative damage, inflammation, we have hormones interfering. Um, when it comes to fertility, this also affects our microbiome,
Mm.
right? So the microbiome that we have in the gut, in the vagina, in the uterus, that's going to affect fertility, right? So there's all these like little micro shifts happening internally. Now, what does this mean for fertility? Well, we know that when, we have cases of obesity, it can lead to worse pregnancy outcomes, right? So we do tend to see, even if the embryo is completely normal, maybe it's euploid or you've conceived naturally, it might not be the embryo or the egg itself that's always affected, but it could be also the uterine lining itself. So some of these effects from hormones and inflammation can actually affect how the uterus responds to the signals it needs to change for implantation. And that's why we tend to see higher pregnancy loss rates, lower live birth rates. And in addition to things like, preterm birth, gestational diabetes, high blood pressure, sleep apnea, right? So all these other comorbidities or health risks with obesity. So it all kind of adds up. And it's interesting as well because in IVF, I'm just gonna let's say one more thing on this one.
Okay.
In IVF, I got told you I love this topic. I could talk forever on it. In IVF, this also means that you might need higher doses of medications. They might have to start with addressing insulin sensitivity first. It's also why we see lots of doctors prescribing metformin for fertility, because
Mm.
that's one of our insulin regulators, right? Even if you don't have diabetes. So risks that we have with IVF, higher doses of medications might be needed. You might end up getting poor egg quality, maybe not. Hard to say. Studies are kind of mixed on that one. I see some that do show poor egg quality, some that don't. But the other thing to keep in mind is it can also be more difficult to access the ovaries for all these procedures. When we
Mhm.
have to get ultrasounds done, if you're going through IVF and you need an egg retrieval, um, physically it's harder to do these exams and these procedures for technicians and for nurses when we have stuff in the way, right? Whether it be bowel loops or gas or tissue or whatever it is, it makes it more difficult. So there's the physiological effects, but there's also the physical effects if you have to get treatment. This might be a more difficult route as well.
Okay. Thank you for sharing. That's so insightful and segueing into my next question, which is obviously a lot of people go into the doctor for whatever reason. Fertility is our topic, obviously. So we'll say for fertility treatment, and they hear the dreaded three words, just lose weight before treatment. So go lose weight, come back, and once you've lost weight, then we can start on it. Obviously, that advice is so unhelpful because they've probably tried, and there's a reason why it's not happening. And some bodies are just made that way, and so why? We know that advice is unhelpful, but why is it so unhelpful? And it's also harmful.
Yeah.
What can you talk about in regards to that?
Yeah, it's like you're given an instruction and you have no way to know how to complete it,
Yeah,
right? I mean, if it were so easy, like just go lose 40 pounds or go lose 20 pounds or, even like 10. And someone's like, well, if I could do that, then I would have done it.
yeah.
Right? And we wouldn't have the issues that we have. We need to understand that weight management and metabolic strengthening and health, it's kind of an uphill battle for a lot of people. It's not
Mhm.
as easy. And sometimes it is like, okay, let's clean up habits and, get moving and, the basics. But for other people, they're working against genetic factors or other health factors that get in the way. And it can be really hard to do on your own. And other people maybe just don't know where to start. So, like, what is more important? Is it exercise? Is it diet? Is it the toast that I'm having with my breakfast? Is it like the oil that I'm cooking with? Like, what am I doing wrong? No one really knows where to go with this. And it's understandable because we're all so different. We're all individuals. The other reason why it could be harmful is when it gets very overwhelming, and not everyone has the resources to do this. So when a doctor says just go and exercise, well, someone might think in their head, well, I can't afford a gym membership, right? Or I can't afford organic, healthy food because it's just not in our budget, right? So the idea is that as a naturopath, I'm here to work with you in your situation. And that's really where we should be taking our healthcare is okay, well, what do your resources look like? What does your environment look like? Okay, let's talk about, your day, your schedule. Where can we fit things in? What does your life look like to you? And what's in your genetic lineage? Do you have a parent who maybe also has diabetes or cardiovascular diseases, right? So it can be a really I mean, we say it as a, "Hey, just go lose weight and come back." People really wanna start their cycles. They really wanna try to conceive as soon as possible. So it's really frustrating because weight loss and management, and I do wanna to stress that it is management, can be very long for people. I've
Now,
gone through this Yep, sorry, go ahead.
sorry, we have a question coming
Yeah.
in. The question is that damage reversible?
It can be.
Okay.
It depends on the extent of it, to be quite honest. So, and it also depends on our age, because
Mm,
as we age, we can't repair things as well as we could when we were in our 20s. We just don't have the same precise, mechanisms to do that. right? So some damage is, and our cells are always dividing, so we can also then protect the new cells that are going to be dividing and growing and so forth. It's why when it comes to egg quality, you can't change what eggs you have left in you. We're born with all the eggs that we have, but you know all of the eggs that we have are still in their really, really premature state. They have to keep growing to be a fully mature egg. So, if we protect those follicles and those eggs as they're growing, we can help to prevent damage, um, and even like a good quality egg sometimes can even help to fix damage in certain sperm as well, which is kind of cool. But I'll save that for another for another day. Getting back to this, when we talk about stress as far as, what to do when your doctor tells you to lose weight, we have to, process this more on like how long is this going to take, and be realistic with our goals, right? So for me, losing 40 pounds took years, right? This wasn't like, oh, I'm just going to do like a boot camp or, this like jumpstart program and I'm going to be bikini body ready in like 12 weeks. Right? No, these are like long-term habits that we want to create to continuously get you on the path to improving health, right? And I also look at it from a perspective of habit keeping. As far as, when we fall off the wagon a little bit, maybe you have a special occasion or you're on vacation, you're not exercising the way that you normally would, not to be discouraged, right? Like you haven't lost anything. You can get that momentum back. So don't think of this as like an ultimatum, lose the weight or you can't get pregnant. It's the, hey, let's keep working at your health, right? We want to just decrease and minimize health risks. And we have to remember that our bodies don't respond the same way to the same things. So, for one person, it might be that strength training works better for them. For somebody else, it might be cardio. For somebody else, they might need both. Someone might be better with HIIT workouts. So, all of these things can take time to figure out. And it's that kind of discovery journey that is part of this whole process. That's part of weight management and metabolic health and chronic aging and trying to stay healthy is, okay, well, right now, what does my body like better? What do I feel better with? What am I responding better to? Right. And being in tune with our body so we can recognize how we feel when we change these habits.
What do people get wrong about the connection between weight and fertility?
Yeah, it's a great question. I have two. So the first is that it's when I want to say that it's never too late to start, right? That's a truth. It's never too late, and I think that um, any changes that we make that are positive for our health are worth it, right? The second thing I would say that, the connection that we see between weight and fertility, some people will see it as fat shaming, right? That maybe it doesn't matter as much that, and I've seen this on, fertility forums as well, um, that we tend to take weight very personally, right? Because it's our bodies, it's us, and that's linked to us. So I think there's a lot of resentment out there with BMI cutoffs without knowing why they might be in place. So I think we actually need to recognize that this isn't something that's totally personal, but it's recognizing that we want to keep you safe. We want to minimize health risks of obesity, and not just with fertility and trying to conceive, but also with pregnancy and the outcomes in the fetus and offspring. Because this body that we're trying to get pregnant, that we're going to be growing a baby in, this is the life source for the baby, right? From their earliest stages of development, from like 2 cells onwards, right? So we're looking at optimizing the health of the environment that your baby's going to grow in, right? What you do now can actually affect your child's gene expression. You're setting up their health now and in pregnancy. If your body's always going to be in like, or if your body is always in like a chronic inflammatory state, that's what we're using as like your baby's growth incubator, so to speak. Right. So the reason why we have cutoffs in BMI is because of health risks, because you might need higher medication dosages. That also puts a bit of a burden on the liver too, right? There's higher risks of IVF not working. There's higher risks of pregnancy loss. There's higher risks of gestational diabetes. And if you have insulin resistance, either going into pregnancy or during pregnancy, your child actually has a higher risk of developing metabolic disease or having poor glucose regulation as they grow up, right? So it's important to think that I think doctors are trying to have your best interests at heart, but they're not always explained that way. So I think that would be an area that kind of gets a little bit messy sometimes.
Yeah, I think maybe they deliver it in a very medically jargon kind of way, and it is the way somebody feels about themselves, right? It's very emotional, it's very psychological, and it's like you said, it's you. So when you're hearing that about yourself, it doesn't feel great. And so maybe a little bit more compassion, or putting a little bit more of the human back into it. I'm not saying all doctors do this. There's definitely doctors that do a very good job, but putting a little bit more of the human back into the patient care would probably go a long way with a lot of people that struggle with this during infertility treatments, for sure. So this obviously is our focus for tonight: BMI, weight, infertility. But are there any effective ways or more effective ways to support someone's fertility than just always focusing on like the weight loss and the BMI and all of that?
Yeah, I take the pressure off of reaching the numbers. Like, get the numbers out of your head, just forget them for now, right? It doesn't really matter right now. Instead, let's just focus on getting you feeling better and healthy, right? Let's address your sleep. Let's address your ability to manage stressors in your life. Let's look at your energy. How do you feel physically? I want you feeling stronger. Do you have issues, carrying things in your day to day? What's your mood like? Right? Like, the idea is like, hey, let's work on some things just to get you feeling really good. And all of this starts with creating and maintaining these healthy habits. So, what time are you going to bed at? How much sleep are you getting? Are you drinking enough water? Like, what do you need? What does your body need? Let's focus on these health promoting behaviors and kind of away from the weight centric goals, right? And that's also why I love being an ND, a naturopath, because we're really looking at you as an individual person. What have your past struggles been like? What has been harder for you? What's worked for you and what hasn't? Right? So it's not just a list of here are the guidelines and this is what you should do, right? Go
And
get
it's
your
not just the now.
150 minutes right now, right? Yeah.
Right. It's not just the now. It's let's look at you as a whole person
Mhm.
forever and see what we can do based on your your chart of life kind of thing, not just like right now in this moment, what do we need to do?
Yeah, exactly. It's also the reason I'm going to talk about testing in a little bit as well, I think. But looking into your genetics, right, and
Mhm.
making a plan based off of that. You're an individual, right? You respond to different things differently than other people. You might need a supplement that somebody else doesn't need. Maybe you have an enzyme that doesn't function as well in your body,
Mm.
right? So again, this is what I mean by when you're tackling like this uphill battle, you might be holding on to extra packs that somebody else doesn't have next to them, even though your bodies might be the same size and shape, right? There's that genetic component and that there's that environmental component. And so even as something as like when it comes to exercise, I'm often asking my patients, what does your day look like? What does your week look like? Where can we squeeze this in? What makes the most sense for you? Right. And more importantly, also like, what do you enjoy doing?
Mhm.
We're not all meant to be runners. We're not all
Mm.
meant to be gym rats,
Yeah.
and that's why there's so many different ways of being active. So I love helping to match patients with their groove. Like, right? Like, are you a yoga person? Are you a swimming person? Do you want to do wall climbing? Like,
Mhm.
do you like gardening? Like, just squatting in the yard can do so much for your glutes and for your legs, right? So it's about, what does your time management look like? How can we squeeze this in? What do you enjoy doing? Are there things that and all these things can also help with stress. So I also love like the overlapping recommendations. So let's help with stress and get you some movement or get you some strengthening. What does your support system look like? right? So all of these things can be brought together for like this nice, like individualized, like just plan for lack of a better word, but it's like, it's a plan for you as an individual and a person. What do you need? Right?
Yeah.
Yeah.
So let's talk about what support can look like, because you touched upon
Mhm.
that a little bit. What are some practical ways to support fertility that don't center on weight?
Yeah, so kind of similarly, as I was saying, like it's kind of building on, what are the roadblocks that you're noticing as an individual and how can we help you with that? So, practical ways are, do we emotionally eat? Do we need something else there to help us through that? Right? So looking at nutrition for energy, as opposed to for emotional support, right? And kind of tackling any kind of mental blocks, past traumas, or just past issues that you've had, right? So, from a practical side, we often say, like, okay, well, protein's really important. Let's look at your protein. What's the macro breakdown of like carbs to proteins to fats in your diet, right? But again, like, I don't like getting hung up too much on numbers. This is more about, um, nurturing your body, right? Like maybe you're the kind of person that you need extra fiber because it helps you to have a good daily bowel movement, right? That could be something very specific to you that can still also support your fertility. Your stress management might be doing Pilates at home, right? Or whatever, yoga or whatever, does it for you. That can be your stress relief as well as getting you moving.
You need to do something you like. Because there's
Yes.
people that really love to exercise and do movement, and then there's people that don't like it.
Nope.
So you have to find something that you like. I've found that for myself because if it's something that I don't like, first day will be like, I could do this. Second day will be like, I can probably do this. And the third day will be like, I'll probably go watch a show and then I'll do it. And then it never happens, right? You have to enjoy it. If you don't enjoy it, you're not going to look forward to doing it. Um,
Absolutely.
it's never going to be your favorite thing, probably, but something that do puppy yoga. Everybody likes puppy yoga.
Yeah. Yeah, and there's different ways that you can make it more enjoyable, like doing something that you like. So, for example, like if you want to do some sort of movement, if it's like walking or you're walking incline on a treadmill or you're outside or whatever, listen to a podcast, right? Or listen to an audiobook or like maybe there's a new album just that came out that dropped that you are dying to listen to. Something that brings you joy. So sometimes for me it's like a oh, if I can go outside, like for a hike or for a run, it's like, okay, that's my me time. I get to like listen to my music, or catch up on a podcast, or like it's my outdoor time. I get some fresh air because I've been locked in a office all day long. So like it has to be something that you look forward to, that you're going to enjoy, that you can fit into your schedule, and that's manageable to keep up with. Right, and you're gonna have good days and bad days and good weeks and bad weeks, and, like, that's okay, like, that's just life, like, we just have to keep going with whatever life throws at us and understand that, you can just it's still progress even if you hit a roadblock, um, and we can find a way to squeeze these things in. It's just a matter of, you know, finding the right time that works for you and your schedule and for your life, right? I do have, some people who are kind of, trying, with secondary infertility, working for baby number two, and they're like, "Well, I already have a little one. How can I do this? How can I get this done?" And I'm like, always busy. I'm either working or looking after the little one. And so we try to find ways of like, okay, well, what's your little one's personality? Would they be okay like playing in a playroom while you had your yoga mat out next to them? Are they small enough? Could you put them in, a jogging stroller and go out and push them like doing, a fast walk or an incline walk with them? So it's about, okay, let's troubleshoot. What does your life look like?
Mhm.
Let's try to work around that and give you what you need. Like you need some time for you, right? You
Yeah.
have a good neighbor, a family member, a partner, somebody, a babysitter who can like, you know, be in the next room watching your little one while you exercise in the other room or go out to a class, right? So it's about, again, very much individualizing it.
We have some other questions
Mhm.
coming in if you wanna answer. One is, do you like inositol or berberine for insulin? I think I said that right.
Mhm. Yeah,
Berberine for
berberine.
insulin instead of metformin.
Yeah, so as a naturopath, I can't prescribe metformin. We're not allowed to here in Ontario. So unfortunately for me, like if I do have a patient who needs an insulin regulator, inositol or berberine are more go-tos.
Mhm.
I find as far as on the spectrum of like all three of them, I do find metformin tends to have more side effects for people. Like usually it's like gut related. And sometimes some people can get past that and kind of get through that initial phase of adjusting to it and they're okay with it, which is great. It's fine. If you can deal with it, then all the power to you. Take the metformin.
Yeah.
For people who are just like, my doctor told me to take this and I'm not taking it, like, what else can I do? I'm like, okay, well, if you're not going to take it, right, then yeah, let's use the inositol, right? For really stubborn cases, I'll use berberine. Similarly, I find inositol has less side effects and is a lot more tolerable.
Yeah.
Whereas berberine works really well. It has so many different actions. It's a great herb, but I do find, you have to start a little bit lower with dosing and make sure somebody tolerates it.
Oh,
And if they don't, if they do tolerate it, then great. Like that's a great one too. But inositol is really lovely because it affects three different receptors and their sensitivity. So thyroid, insulin, and follicle stimulating hormone, which is why I like it so much for fertility. It might also be more cost effective than berberine. I'd have to double check that, but I do use those and like them quite a lot.
okay, got another question.
Hmm.
Is there anything special? Is there any special information if high BMI is linked to thyroid?
Yeah, that's really interesting. I think it would be more to do on the genetic side. So I think that having hypothyroidism is, going to give you a higher risk of developing obesity. So I think there is that connection. If you have a high BMI and you have either a family history or you've got genes that predispose you to hypothyroidism like that, I mean they can kind of go hand in hand, like chicken or egg, so I think that there is a link there. I don't have any specific stats or research in front of me on that right now, but I would say that there's a higher risk if there's especially if there's like a genetic component.
Okay. Okay, this is my question now. What kinds of labs or tests, lab tests or health assessments do you recommend beyond the spectrum of BMI and weight loss and all of that jazz?
Yeah, so apart from like body composition measurements, when it comes to testing that I often recommend, first of all, for fertility, it's the cycle day 3 hormone panel, like just the basic. Hey, let's just see what your ovaries and your hormones are doing, kind of at baseline. So we're looking at estrogen, progesterone, often testosterone, FSH, LH. Um, I tend more for on the metabolic side. I do fasting blood glucose, fasting insulin. And then we can use those 2 values to calculate what we call the HOMA-IR, which is like a homeostatic index of insulin resistance. You can also do an insulin challenge. I just find it's hard for some people to do it because it's like a 1 to 2 hour test. You have to drink a big bolus of sugar, and then basically you're looking at how your body deals with that sugar. It's a good option for patients to do. I just find that oftentimes it's very time consuming, and
Mhm.
so doing fasting blood glucose and fasting insulin sometimes is a slightly, easier way of looking for insulin resistance. Apart from that, some extra testing that I'll sometimes do, cholesterol panel, right? Just looking at, the cardiovascular side of things. Do we have high triglycerides? How's your good cholesterol, right? That's another factor.
Yeah.
Things like, thyroid and thyroid antibodies. For nutrients, I do find, obesity can also be associated with just feeling fatigued, right? Fatigue is
Mhm.
a big one. So I'm often going to screen for, vitamin B12, for iron. I do vitamin D testing. And then that genetic SNP panel. I do find genetics to give us a lot of information of, how do I treat you as an individual? Because you are different than A, B, and C next to you, right? So those are all helpful tests that we'll use.
Thank you.
How do you help patients work with their bodies instead of feeling like their bodies are the problem?
Yeah.
Right?
Totally. And I'm kind of there with you. I have all the genes for metabolic disease, for hypothyroidism. I have histamine intolerance. I have endometriosis and poor estrogen. Like I'm loaded with them all. I had my genetic testing and like it was like red flags everywhere. And I'm like,
Oh,
okay,
no.
no, I still love my body. Like, and I think that's really important is like we have to remember like you only get one body in this life. This is it. And you have to love it. Or we have to learn to love it. Right. So the idea is to work with your body, not think that your body's the problem. We can be dealt a pretty rough hand in life. And again, this comes with a little bit of privilege as well, right? Some of us, myself included, I will admit, like I do have more privilege when it comes to the ability to manage some of these things.
Mhm.
But it's about working with what you have. And I do that for anything, whether it's the way that you want to look at your body and kind of reflect on that, or it's in the way that we do, treatment, recommendations. It's like, okay, well, you have to work with what you have. You can only do what's within your means of doing, right? So, again, it's you know you might not be able to afford organic food all the time, but hey,
Mhm.
do you have a box of baking soda at home? Because we can wash your produce with baking soda, right? Do your grocery shopping, bring it all in, put it in the sink, fill the sink up, add baking soda, let it soak, rinse, and like you're kind of good to go there, like trying to get residues off of it, right? So like there's ways that we can work with what you have. When it's with your body, again, we have to learn a little bit of self love, right? We're there. It can be an uphill battle for some of us, and some of that comes down to eating habits, the emotional side of things, and how we address that. This is a really long journey. This isn't just you're gonna fix it and feel better immediately, and all of a sudden, all your previous, body dysmorphias and issues are just gonna disappear. Like it's not gonna happen that way. So, I will say that, if we have genetics information, it's a lot easier to point out and say, "Hey, like this is why maybe you've been having this issue or that we've been seeing you react this way is
Mhm.
you have a version of this enzyme or a version of this gene that isn't working properly." So maybe for example, like you can't convert, the healthy fats from nuts and seeds into anti-inflammatory EPA. Your body can't do it very efficiently or effectively.
Yeah.
Right? So that's something that it's like, okay, so that enzyme's not working. You could say like, okay, that's a problem with me. Or you could say, hey, my body doesn't work this way. I got to find a workaround. What does my body need? How can I work with my body
Mhm.
and kind of step out of that box of normal? And I sometimes see that, I mean, we have to be very careful sometimes with social media because sometimes I'll see things that are in absolutes, like you need to do this or you have to do this. This is the only way to do it. But it's not, right? You have to consider that you are a very unique person. And if you don't fit into that box, you're not the problem. You're just a completely different person. Right. So we have to keep that into account.
So I'm just a little bit curious. I'm going a bit
Mhm.
off script here.
Mhm.
You've mentioned doing some genetic testing. What does that entail, and like, what do you actually look for when you do something like that?
Yeah. So it's a cheek swab test. As naturopaths, we can't requisition them ourselves, but these are things that are often just marketed to the public. So it's basically direct to consumer. So you can take you know other genetic tests that used ancestry, and sometimes you can take that raw data and you can plug it into a health-based database that helps you to pump out the actual health-based information. And there's also some really good health-based genetic tests out there that are already on the market that are tailored as like health information. So there's a couple that I'll use or that I'll recommend to patients to go look into. And so
Mhm.
what they do is they order the test online. You do a little cheek swab. You send it back away to the lab, and then we get a whole bunch of information as far as how does your body handle carbohydrates? How do you handle saturated fats? What kind of exercise is your body built for? Are you built for short bursts of intense, activity? Are you more of a slow burn? Like your body does better when you can like do endurance work and work at a lower intensity, right? So it's about looking at those unique things that your body can do. And of course, like the result panel, I mean, it's not going to be as clear cut and easy. It can be really hard to kind of figure out how to apply it. So I really do recommend like you need to see either a genetic counselor or somebody or a naturopath who can or somebody who can really decode it for you and show you how it's applicable. Because you could have like A, B, and C gene versions that increase your risk of obesity, but you could have, E, F, G that actually decrease your risk of obesity. Well, now
Mhm,
you're left thinking like, well, which is it? Am I gonna develop it or am I not gonna develop it? Like, what do I do with this information? So
mhm,
that's why we're kind of here to help to, and genetic counselors can help to kind of decode that a little bit and just tell you what to pay attention to, what are you looking out for, which tests might be more relevant for you versus somebody else. And if you can't do testing, the other thing I say is, just pay attention to your body, like know your body, pay attention, keep track of both, your accomplishments and your progress, what's working for you, what's not working for you. So, like, hey, if you start doing HIIT workouts and all of a sudden you're actually starting to gain weight and you're not losing it effectively, like, let's take note of that. Let's try something different, right?
mhm,
I also find, there's a lot of different apps out there, obviously. There's, like fitness watches you can track things on.
mhm.
I even, what is this? Yeah, this is my one. I even have at home here, like a little pad of paper that has the days of the week on it. So I was like originally like handwriting things out, like I did 30 minutes of yoga today. Like, and my
Like a
energy was
diary.
this, like a diary, but it's like jot dot, and it's just keeping me accountable for the week. Like, hey, what was this week look like? I had a really rough work week. My hours were really long, but I was able to do like 20 minutes of recovery or like, whatever it is. But it at least allows you to reflect on what you're doing, how far you're coming, what works for you and what doesn't work for your body. Right. And I think that's really important.
Thank you for sharing. Before we wrap up, I have a few more questions.
Mhm.
If you'd like to answer. We're talking a lot about the person going through the fertility treatments, but if people have partners involved, what can partners do to support their own health, but also support their partner going through the infertility treatments at the same time?
Yeah, if you have a partner at home, I'm a big fan of going through this all together. I Conceive Health, we do couples consults as well.
Mhm,
So I do really like those because it's a matter of, okay, we're the two of you are together. You can
mhm,
tell me about each other's like sleep habits and eating habits. And also if I'm going to recommend something, I'd like it to be a household recommendation. Because that way we don't have somebody sabotaging you. And I've seen this before too, where I see one partner and they're like, I'm trying to be so good, but my partner keeps bringing home like donuts or cookies or chips or whatever. And it's a big sabotage for somebody who maybe can't control their appetite or can't control portion sizes.
yeah,
So I think ideally, if one person's on this journey, you're both on this journey, right?
mhm,
And I think that also comes down to being a supportive partner. And again, title of my book, It Takes Two, right? Like it takes two, an egg and a sperm to make an embryo, and you need a good uterus. So all of these factors play a role. So I think that
mhm.
a partner should be also looking at their health, and you should be encouraging each other.
Yeah, agreed. Okay. And is weight gain always a bad thing during fertility treatments?
No, not at all. Some people, I mean, it's hard. We get really self-conscious, especially even if you're just feeling bloated, right?
Mhm.
Even if it's just like
And
water
there's
weight
so much
or
bloat.
bloat, and it makes you feel like you're huge and it's uncomfortable and it doesn't, you don't feel great, right? And unfortunately, a lot of the medications that we use can affect water balance and bloat and weight gain. So I would remark that keep in mind it's temporary.
Mhm.
Your body is getting, doses of hormones that it would normally not see. And even with a regular natural cycle with no medications, I mean, with fluctuations in normal, menstrual cycle hormones, we notice changes in things like bowel movements and bloating and water retention and, breast tenderness and all these things. So now imagine that you're boosting up even more hormone levels. And of course, you're not going to feel great. Of course, you're not going to feel like you look like, your best.
Yeah.
And so it's hard, but just remember what it's all for and know that it's temporary and that, and allow yourself to recover after this. I think that's really important too. I will say that, during fertility treatments, a lot of people get really nervous about exercise because they think
Mhm.
it's going to be detrimental to fertility. And I have to kind of pull people back and I'm like, well, yes, there is certain times through fertility treatments that you do want to scale back, but there are other times that you don't. right? If you're going
Mhm.
through IVF and you're doing an egg retrieval, well, yeah, your ovaries are going to get so much bigger than they're supposed to. So you're going to feel that pressure. You're going to feel that extra like bloat feeling or that intense kind of fullness feeling, right? Um, but but again, like we have to remember, yeah. So recovery from that, it just takes some time, and just be gentle with yourself. Like really, just go easy. Be kind.
Yeah. I think we all forget to do that.
Yeah.
Um, we tell other people, we have no problem telling other people, and being kind and gentle to other people, but we're very hard on ourselves, as people, which is terrible. It's terrible, but you're right. Um, okay, I have another question.
Mhm.
Can decreasing body weight help to decrease a higher FSH?
A little bit. It's kind of it's a complicated kind of relationship. So, I mean, FSH increases when the ovaries become less responsive, right?
Okay.
So, to give you kind of an idea of the scale of things, if somebody is kind of menopausal, we'll say like FSH is usually like above an 80, right? Ideally for a regular menstruating, cycling female who's going in for fertility, FSH can, hovers kind of around like the 5, like around a 5, but it can go up to like a 9 or so. Anything around like a 10 to a 15, we kind of keep an eye on it because we're like, that's a little bit higher than we'd like. Let's just see what the ovaries do. And if they, if we can, get a good ovulation or, see how your cycles are panning out. So that's kinda like the wait and watch period. Anything above a 20, I would say like 20 to 80 in that kind of area. It's a bit more like, okay, are we suspecting maybe reduced ovarian reserves, like less
Mhm,
eggs, so the ovaries don't respond as well? Are we looking at like we're in that, 5 to 10 period of perimenopause, right?
mhm,
So when we're decreasing body weight, sometimes it can be just because you have better insulin regulation, right? And so better insulin regulation will take out one of those factors that can affect ovarian function,
mhm.
right? But if your higher FSH is due to age and egg reserves, it's not going to change that aspect of it. It would just affect the like taking away a signal that's preventing follicle growth and development.
Got it. Okay.
Yeah.
And we have another question. I think the question's trying to say, if a man had high BMI, would it affect his sperm quality?
Yeah, absolutely. It can. It absolutely can. And it comes down to that aromatase enzyme that we talked about. So the more
Okay.
adipose tissue you have on your body, the more aromatase enzyme. Aromatase is going to turn testosterone into estrogen. So for a
Mm,
man, what this means is that we're going to decrease. We have a higher risk of lower testosterone and higher estrogen. That's going to affect sperm production, right? So we're looking at, a sperm analysis would tell us, as well as just testing estrogen, testosterone, FSH, and LH. I would
yep.
test all of those in a male patient just to find out, is it affecting you? And of course, we still have to keep in mind that, with obesity, if there's greater adipose tissue, right, then we're looking at, also inflammation and things like that.
Mhm.
So BMI in a man might not necessarily mean anything, but it's about the body fat percentage. And if it is like true obesity with excess adipose, then yes, we do see fertility decrease in fertility with that. But a high BMI that's due to really high muscle mass, maybe not. It really just depends on what's going on inside the body.
Got it. Thank you.
Yeah.
Thank you for answering our questions.
Sarah, thank you so much for this powerful conversation. Where can people find you if they want to learn more or work with you?
Yeah, I'll kind of break down a few different ways. So, I'm a naturopathic doctor at Conceive Health here in Toronto, but we do see patients virtually all over Ontario. So, for more information, you are welcome to check out our website, conceivehealth.com. We do also offer free 15-minute discovery calls if you just want to get some information or see if one of our NDs is a good fit for you. We also do have a metabolic program that we offer on a monthly basis. It's a 12-week program that comes with one-on-one coaching and group coaching, naturopathic support, nutrition plans, plans and exercise plans and kind of a whole nice package. For me specifically, you can check out my website, sarahzadeknd.com. Or you can check out and pick up a copy of my book, It Takes Two and a Uterus, which is available pretty much anywhere you can get books, Amazon, Indigo, anywhere ebooks are sold as well.
Perfect. Thank you so much. People are loving this episode. They're commenting that they love it. So very, very good. And for people who weren't able to tune in earlier or are just tuning in now, this episode, like all our other episodes, will be up on our YouTube, on our Facebook, and our Instagram. So you can go watch it whenever you want. I believe it's on Spotify. It's going to be on Spotify as well. Dr. Sarah also has a few articles out and she has a book. So please pick that up. And don't forget that you can go on Oasis, on our Instagram, on our website, on our Facebook, on our YouTube, watch all of the episodes. You can stream episodes of the Fertility podcast, the Oasis Fertility podcast. And also, we have our support groups once a month. You just missed the last one for July, but we have August coming up soon. So don't forget to sign up to that on our website. And we are always here for you, no matter what.
Remember, you're more than a number. Your fertility care should reflect your whole body, not just your weight.
Also, one more thing, I am so sorry. Do not forget that Oasis Fertility Support Network also has a wonderful fertility journey journal that has been created with everybody in mind and every part of your journey in it. This journal is free online to anybody that wants to order it until September 1st. So please go ahead and pick up your journal online. Go on our Oasis website. It is free to everybody until September 1st. And then after September 1st, I believe there is a small shipping fee. So please go get yours before September 1st. It's such a beautiful journal and resource to have during your journey. So I just wanted to plug that in there. Shameless. But it's free. Go get it. Thank you so much for being on, and we'll see you next week on Fertility Village Live.
See you next time.